The protests have many health officials and local leaders warning that it could lead to a spike in coronavirus cases. Dr. Anand Parekh is the chief medical advisor at the Bipartisan Policy Center. He's also a former deputy assistant secretary at the Department of Health and Human Services. Dr. Parekh, good to see you again. We have the mayors of Atlanta and Washington, D.C. now telling people who were part of those protests this weekend to go out and get COVID-19 tests. How worried should we be that these protests are going to lead to a spike in the virus again?
I think, Alexis, anytime you see a mass gathering like that, so many people so close together for a significant duration of time, particularly when there's chanting and shouting, it does increase the risk of transmission. I think the silver lining here is this is being done outside, and we know outdoor transmission occurs significantly less frequently than indoor transmission. So we're really not going to know the answer to how many new cases could there be because of the protests, probably for a week or two. But I think, Alexis, the key point is that for everyone engaging in peaceful protest, it's going to be really important to continue adhering to hand hygiene, respiratory etiquette, social distancing. Now, that may not be always possible, so the use of cloth-based masks is going to be critical. Now, again, if you do all of those things right, it could be that there are other people around you not doing all those things too. So to your question, testing is probably pretty important in these areas. These are urban areas where there has been a transmission of the virus. So I think in many cases for individuals, their testing will be appropriate.
Doctor, listen, I've spent the whole weekend looking at these images on Twitter. Some folks in the protests are wearing masks, some aren't. But just from I'm trying to help investors understand the situation. Is it safe to assume a second wave later this year?
Well, I think, Brian, the rest of the summer, there's a lot of fuzziness here in terms of predictions. We're still at about 20,000 confirmed cases every single day because we haven't really ramped up our testing and tracing capacity yet. There's increased mobility now. States are reopening up. So I think, unfortunately, for the next several weeks and a couple of months, we're in this gray zone. But I think the real concern, Brian, is in the fall. And it's in the fall because we experience a flu season every year, which nearly incapacitates the healthcare system. You can imagine flu plus COVID-19 simultaneously. Also, it'll be colder. People will be indoors. And I think the concern is if we're not prepared with testing, with tracing, if we don't have treatments, if we haven't stockpiled what we need, then we could be in a situation, particularly later in the year, where we're facing a potential temporary shutdown once again. So I think that is really the concern for the fall. For the next couple of months, we really need to, from a policy perspective and a programmatic perspective, get our testing and tracing, to its maximum capability.
Speaking of that policy perspective, a couple of days ago, President Trump announced that he is going to pull the U.S. out of the World Health Organization, saying there just hasn't been enough transparency from China and others, specifically the WHO. What is your reaction to that? And what does that do to the world's ability, really, to test and trace adequately?
Alexis, I think it's a poor decision. Global health is U.S. health, and the WHO is critical in preventing, detecting and responding to outbreaks, not just COVID-19, but other outbreaks as well. They're central to ensure global health. And so I think it's perfectly fine to say that the WHO may have made missteps, and there's certainly quite a few inquiries that are needed. Our very own CDC here in the United States made missteps as well. The response domestically is not, let's defund the CDC. And so I don't think just defunding or pulling out of the WHO is helpful for U.S. health. It's not helpful for global health. It doesn't send the right message either. So I think on multiple levels, unfortunately, it's the wrong decision.
Doctor, there's a senior Italian doctor who is saying that this coronavirus is losing its potency. He says it has become much less lethal there in Italy, and we know how hard hit they were. Are you seeing any other evidence that that is the case, that it is not as strong as it was perhaps even a few weeks ago?
Alexis, I haven't seen a lot of data or research confirming that. This is still the same virus. Viruses mutate, that's what they do, but in essence, this is the same virus, the same mortality rate, the same transmissibility. The difference is what we do, what our human behavior is, what our response is. The only way we get through this is really having a vaccine. That's the quickest way to achieving herd immunity. And there is significant progress there, but it's going to take, likely a year until significant if all goes well, until significant portions of the population are vaccinated. So I think we really have to be smart about the road ahead.
For sure. And we know dozens of companies are working on that vaccine, and we've seen their stocks skyrocket as a result. Dr. Anand Parekh, thanks as always for being with us.
Thank you.